Welcome to the PUTTcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their greed-centered, profit-at-any-cost business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Hello and welcome to another episode of the PUTTcast, brought to you by Pharmacists United for Truth and Transparency. I'm Lauren Young, pharmacy owner and vice president of PUTT, and I have one of my favorite co-hosts with me, Monique Whitney, the executive director of PUTT. Good morning, Monique. How are you doing?
I'm good. Thank you for saying I'm one of your favorite hosts. That's nice.
I love whenever we get to talk about one of my favorite topics, advocacy. I absolutely love it. You know, this is a passion of mine, and this is something that pharmacists have really started letting their voices be heard about because they understand that there is no one else coming to save us. And so we are really working together to try to get the word out as much as possible. And so I'm so glad to introduce our guest today, Fair Jones from the great state of Mississippi. Welcome, Fair. How are you?
I'm good. Thank you guys so much for having me. I'm so excited to get to speak with you ladies today.
Well, as many of our listeners know, I get to watch all kinds of legislative hearings and, just try to help our members across the country try to come together and find as many like-minded individuals in their state that's pushing for PBM reform. And our friends in Mississippi have definitely done that this year. I know that it was a tough legislative session for you guys. Fair, if you want to take a minute and just tell our listeners a little bit about how the Sit for PBM reform really came together and how you guys in Mississippi really got started with your push this session.
Yeah, so back in January, when session really kind of got rolling around, for me personally, I had never really been involved in much politics or legislative issues going on. I was a fairly new owner. I had my pharmacy for about 5 years. And so I was still trying to, figure out kind of really what I was doing. But I knew the past several years had just been really tough on the pharmacy business. And so in January, for me, I had seen a Facebook post from someone else. I don't even think they were from Mississippi, but it was just talking about kind of a story about someone who had they filled some prescriptions that were underwater and just how sad it was. And I had a similar instance that same day of some prescriptions I filled for a mail order customer, not my normal customer, had come in. We filled 2 weeks of medicine for him, and we had made 88 cents on the prescriptions. And I was just so irritated and sad and frustrated. And then I saw this post, and it really just kind of gave me the encouragement to just speak about what was happening. And so I did. And people were kind of shocked. They were like, we had no idea that this was going on. But it also, I feel like, connected me to a lot of other pharmacists and owners in Mississippi who were experiencing the same thing. I feel like sometimes it feels like we're on an island, like we're by ourselves. No one understands. Your customers don't really get it. They try to, and they do to an extent. Sometimes even your staff doesn't fully understand. And so you feel like you're just kind of fighting this silent battle. But then when we all kind of started putting our stories out there about, well, this is happening to me, and this is happening to me, and this happened to my patient, it's happening to my patient as well, it really just kind of connected us, I think. And for me, encouraged me to continue telling those stories because there were many and people needed to know what was really happening in Mississippi. And so, through that and the great world of social media, a lot of us just all got connected. And as we rolled through the session and things kind of didn't happen and end the way that we wanted them to, we knew that we couldn't stop there, that we had to continue on and use the rest of this year to really educate, just people in Mississippi, whether that be our state legislators or our customers, really anybody that we could. And so we have continued to do that with the SIP, and we, we're working hard on the education piece, and hopefully when session rolls around in January, we'll be boots on the ground, ready to, have a united front and push for what we need. So,
and sometimes legislative sessions are an educational piece for owners as well, to learn all the different hoops and different chutes and ladders game that come with being a legislative advocate for pharmacy, because that's not something typically that is taught in pharmacy school. I know that there's so many owners that are now engaging with their pharmacy schools and other students, and just as many people as they can. But whenever you are spearheading a bill and trying to get that passed, there is so many different pieces that you find out it is not as easy as the Schoolhouse Rock song led us to believe. And so there's just so many different ways that your bill can be held or set aside or, just stopped. Even though there is momentum, there are people that were speaking out in favor of the bill. You guys had a lot of support. I know that your own representative, Stacey Wilkes, was very helpful in that. She has been very supportive publicly as well. And that's really what you need, is to have that legislative champion be the first one out there to say, I know this is happening. I'm willing to stand up for my constituents. There has to be other people in the State House to do so.
Absolutely. We're so grateful for Stacey and all that she did for us this past session. If we talk to our legislators, they would say, well, we love independent pharmacy. We support you guys. We want y'all to get what you need. But that didn't always translate to what actually was happening. And me and my naiveness of not understanding really how all this works and learning as I was going, I really thought that I could just stomp my feet and just talk about, how wrong this was, and they would all see the light and it would be great, But now I understand there is a process, and that process starts way before January. And, we were behind we were way behind, and we didn't even really know, which was probably good because we kept fighting, but now we know there's certain things that need to be done, and it is kind of the long game. We have to, keep working through the summer and into the fall. And when January rolls around, hopefully things will be better. But it is definitely a learning curve. I had some friends down in Vicksburg, Matt Hendricks and Michael Jones. I'm sure you know those guys, but I would text them and say, okay, it's in committee. Now what? Like, what happens next? And so they would have to kind of walk me through, okay, this is what we need to happen, what we don't need to happen. And, it's outside of anything I think any pharmacist really thought that they would be getting into when they're in pharmacy school. But, you've got to fight for your profession. And that's kind of where we all are, I think.
Absolutely. And a lot of times legislators hear about the scope of practice issues in the State House level. They hear about test and treat. They hear about prescriber status. I know in Illinois, they passed a bill a couple years ago that pharmacists can now help prescribe hormonal birth control. And so there's lots of different avenues that takes. And so whenever pharmacists are coming to the Capitol as business owners, that is a different conversation that legislators are not used to hearing typically. And so I know that, us at PUT work with so many different states. And Monique, I know that each state is kind of at a different spot. I know you in Arizona have worked really hard to get those independent pharmacists together and collaborating with as many people as you can, since you live in the land of Caremark. And so
Yeah, yes, we do. We had a governor that loved Caremark. He was term limited out, or he'd probably still be our governor. But yeah, no, it's something. It's hard.
And so that's what we work with at PUT. No matter where your group is in your state, we try to help you and, really try to be that sounding board as to what has worked in other states, because whether it's a Republican-led or Democrat-led state, there's going to be different talking points that help get legislators to understand the issue. And so that's really why whenever we were approached at PUT to help our friends in Mississippi, it was absolutely let's break this down as to what inroads you guys have already gotten. What have you guys heard works so far in your state house so we can help get that message out to others. And I love the way that you guys connect and really do try to communicate, not just during the legislative session.
Yeah, I think, for me, my whole kind of the thought that just kept coming to my head through session was I didn't want to look back at the end and say, I did nothing to help, that I just watched it happen, whatever the outcome was. And so I think a lot of us kind of feel that way where we can't just, okay, session's over, well, that was bad, we'll try again next year. It was no, like we have got to continue on, and it's hard. It's exhausting sometimes. Like, there's some days where, even now when we're not really in the middle of anything, it's like just mentally, you're just drained because you're also running a business and you're also trying to figure out how to keep that business alive long term. And so it's a lot, but I feel like we're very lucky in Mississippi that we all, down here in the South, everybody knows everybody and their mama and all the things. And so like, we're all kind of connected in these weird Mississippi only ways that, you'd have to be from here to understand. But, but that, I think that's special for us. And so that really, we kind of all just bonded really well and just really, want to be there for each other and do this for each other. Because yes, it's about my business, but it's also about theirs as well. And, we're kind of in it together. So we can keep it that way.
And Lauren, if I could just jump in on that and say, I think that's really cool. And I also think that that's what's necessary. I've learned over the years that there really is something to the different regions of the country. So the South, we do a lot of work in the South, and it is neat to see how connected people are. And, there's really just less than, maybe 2 degrees of separation and, overcoming that innate sense of, well, that other pharmacy is my competitor, so I can't really join forces with them is incredibly important because getting over that is incredibly important because we really are, united in this thing that's been going on for so long. And like in the Midwest, what I learned is everyone's also connected, but they're connected in a slightly like different way. And it's just neat to see, like, for example, all the work that Lauren has done with the independent pharmacists out there. And, we have several, really good friends that we've made over the years there and seeing how they've come together. That is, since you brought up Arizona, that is one of the things that makes it a bit of a challenge in the West because, if you look back to history, like Manifest Destiny, here we are, creating this United States. And I think they got lazy at one point. They're like, we don't want like 600 states. So we're going to make the last states like really, really big. And so Arizona is huge. New Mexico is huge. Nevada is huge. Utah is huge. And conversely, these are states that have like relatively few independent pharmacies, all spread really far apart. And it makes it, just that much harder to bring people together. So it's, it's wonderful that you rely on that and that you use that to your advantage. So I'd say for everybody listening, if you are in the kind of community where, you can reach out and could have those connections, take a page out of Fair's book and do that.
Definitely.
And I think that on your FairRx Facebook page, your advocacy site, one thing that you have really touched on recently is the pharmacy desert data and sharing that. And I think that legislators need to see, that graphic that visualization of the communities that no longer have an independent pharmacy in them, because that's such a vital touch point for their constituents. I know that there is so much more that you're doing at the pharmacy than just verifying a prescription. I know we have patients that come in and bring their mail to us because they can't understand what something is, even if it's not pharmacy, explanation of benefits. They need someone that they trust to tell them what they need to do. People come in with all different kinds of questions, and just because they know that we as a community connector know someone that could potentially help them. So your asset as a resource in your community is so much more than just the medication that you're giving the patient.
Absolutely. When I kind of saw that new mapping tool and how we could kind of look at the trends and what it really looked like, for Mississippi, we're such a rural state anyway. And so, there might be 3 independent pharmacies here in my town, but we have lots of communities 15 and 20 minutes outside of Grenada that don't have that. And so they're driving in to us. And if we're not here, where are they going to go? They're going to have to go 30 minutes the other direction, which is another rural community, and they may not be there either. And so, it really, I think that, for Mississippi, some of our legislators have said, well, we need to see the data. We need to see the real, we understand what you're saying, but we need to see the numbers. And so I just felt like that was super important to say, okay, here are the numbers. This is not just us making this up. There will not be pharmacies. And when that happens, you're left with people in rural towns who do not have access to care. They do not have, a place to go get their flu shot, during flu season, or they don't, they might not have money to buy gas to go 30 minutes the other direction. And people are going to be sicker. I mean, that's really the bottom line, is the patient is really they're the ones who are going to suffer when this happens. And so, through my Facebook page, I've really tried to focus kind of on, it is about the patient at the end of the day. That is the end game. We need our patients to be healthy and to have the care that they need and deserve. And so I've tried to really focus on that with my FairRx page, and really just, we have to speak out about this. And it's not about being rude or, being angry or mad, and all that is valid, but just really saying, this is the real story. This is really what's happening. Here's the numbers, here's the data that you're asking for. But what that means is that my customer who is 95, who still drives up here every day, what's he going to do, when we're not here? And trying to bridge that gap between the data, the numbers, the what they want to see, but also the real story and how that kind of relates together. So
you want to make sure the legislator they're understanding the data, but also you're telling them that without further action on their part, more of this is going to happen. You're not trying to blame them for the ones that have already closed. You're trying to get them on your side and educate them that this is an emergency. This needs to happen. There's a critical turning point right now that if there is reform, then this can be stymied and there will not be as much of a blow to communities. So that's one thing that the pharmacists in those meetings have to remember.
For sure.
And so on the state side, we kind of talked about how you were able to get with your legislators and meet with them. I know that you guys really emphasized trying to get legislators in your stores for a store visit so they could see all of the different things that you guys are doing in a day, because anyone who's not been in the pharmacy just doesn't understand exactly what happens. And so that is one important thing. Just make sure you are inviting your legislators. They are never going to just show up at your store. You have to actually make the call, email them, and they're used to doing this. They're used to coming to their constituents' businesses and talking to them about issues. So that is not an uncommon practice. It's just something that we have to be more vocal about and asking. That's really the space that we have to take up right now. And so you have also, not only on the state level, but on the federal level, I know that your group has also worked to talk to your congresspeople about the various issues that we're experiencing. And, we kind of talked a little bit about this offline, that there are state issues and federal issues. And you want to make sure that you have the right talking points whenever you're going into these meetings, because everyone knows the buzzword of DIR fees, and a lot of state legislators can't do anything about that because it's a federal issue. Now, DIR fees impact your business as a whole, but you have to make sure you're talking to a decision maker, a policy maker about something that can be done. So that's the important part to remember about those talking points. But I know that you guys have met, like I said, with your congressman, and there's usually multiple owners on that call. So how do you still have your voice heard in those calls?
Yeah. I was on one recently, and, there were just a few things I knew I wanted to get across to them, but because truthfully, in our SIP group, we are very focused on the state level. But for me, I have tried to, we can't forget about the federal side, because that is the other half of our business. And so I've kind of been the one that's kind of stayed in tune with kind of what's going on federally. And so I knew that I needed to get my little spiel in. And so I just very quickly said, I need to give you my 5-minute speech real fast. And so I went through kind of my quick elevator pitch talking points, because I was also working at the same time. So I had to jump off pretty quickly, but I did make sure to follow up with an email directly to the staffers and said, this, just reiterating, this is what I was talking about, and gave him some of that information. And I think they really appreciated that. They had some questions about the stuff that I had sent them. And so, I felt encouraged that they heard at least what I was saying. But I think, whenever you do have that chance to have that FaceTime, however big or small it is, just getting in those quick points. I text you, Lauren, that morning. I'm like, okay, I have a meeting. What's the high points? What do I need to tell them, And so I was so thankful that you had shared that with me, just because I knew it's such precious time to get with these people who are so busy. And it's not something that just you get whenever you feel like it, So I would just say you have to just take those opportunities when they come and just make sure you're focusing on the issue and what they can help, because I know they've probably heard 100 sob stories about, about all the pharmacies that are hurting, and they understand, but there's only certain things certain ones can do. And so, when we're talking to the people in DC, it's okay, this is what we need your help with. And then when we're at the state level, okay, this is what you can help with, and making sure we're just having focused conversations, I guess, so to say.
Oh, absolutely. And I know everyone is gearing up for the Pharmacists Fight Back Act kind of 2.0 that we are releasing here in the next few weeks. And we really appreciate everyone kind of taking FAIR's lead and starting a similar advocacy page. If you go to FairRx on Facebook, you're able to see the examples that she puts out. It is not condescending. It is educational. It's a way that patients and legislators and other healthcare professionals are able to see what's happening on the pharmacy level. And it's a great tool to be able to use and share so that other people can see, because other owners are experiencing the same thing, but they might not be able to articulate it as well as you have. And so if an owner is able to share it and say, this is happening in my store, that gets the conversation going with some of their patients. And you never know which one of your patients has a connection to a legislator that is able to help with PBM reform. And so the more you're able to talk about this and get this out into the universe, in the community, because your patients, like you mentioned, Fair, don't know exactly what's going on. But the amount of information that you're able to put out on FairRx is impressive. And I really think that it would do a world of good. The more voices that we can have like yours join in the advocacy fight, especially pushing on the state level and the federal level. Pharmacists Fight Back is going to need every single voice that we can have. So we challenge everyone to answer the call, right, Monique?
Yes, and in fact, I have some breaking news. As we've been recording, I just got confirmation that there will be a press conference in Washington, D.C., announcing the filing of Pharmacists Fight Back Act, both of them, one for the Oversight Committee, one for Energy and Commerce. What that means, so it doesn't sound quite so inside baseball, is one about the Federal Employee Health Plan and the other about Medicare and Medicaid. December 11th. The morning of, so it'll either be at 9:30 or 10 a.m. So that just came through literally as we've been talking about Pharmacists Fight Back Act. So ladies, I think this is quite the powerful union of minds and conversation as we've been talking. So good news about that.
That's right. All right, everyone, you have your marching orders. You can get out there.
On Capitol Hill. If you need any information, let us know, contact us. We will help you get there.
That's right. Absolutely. In our last few minutes, Fair, is there anything that you want our listeners to know, how they can get more involved in their advocacy? What's that? It can be scary, but what would you say could help get them to dip their toe into taking that first step?
I would say, definitely it is scary to put it out there. And I think sometimes to say it out loud, it makes it true too, and so for me, you kind of want to, it's okay, it's going to be fine, and we're not going to talk about it. But, I would just encourage owners to, you're not alone, and you're not crazy, and you're not doing anything wrong. And we are all in the same boat together. And so, just really, just put your foot out there, just step out there, give it a shot, and be encouraged. Your patients love you and they need you, but they don't know how to help you if you don't tell them. And so I think that once you kind of put it out there and patients start asking questions, and you can have those honest conversations about what is actually going on and why we need their support, that makes it easier. And when, for me, when we started kind of putting things out there and our patients would call and say, what can I do to help you? Because I need you. That really fueled me to keep going, because it's about the patient, and that's why we're doing it anyway. So yes, it's scary, but I promise you the rewards are great. Even if it's just that pat on the back from the people in your community saying, we got you, we're going to help you. Like we're here for you. We love you. That sometimes is even better than the wins, maybe, in other ways, just because that helps our mind and our heart kind of keep the fight. But, I would just be brave. You're not alone. And, the more people in your community that know what's going on and can get involved, the better. But they don't know what they don't know. And so you have to be the one to do that, and just putting yourself out there. That's what we all have to do. No one is going to come and save us. Like you said, Lauren, we have to do it for ourselves, and, we got to do it now. So I don't know.
Right. Absolutely. Yes. There's no time like the present. So, and it's amazing the types of information that people will connect with. So just because you have seen your 10,000th claim for the year be underwater, someone who realizes that it was an insulin medication that was paying you underwater, or their blood thinner or something, you never quite know what story is going to resonate with someone. So do not be afraid to share the information. You cannot over communicate with patients enough. I don't know how to say that any clearer, but sometimes it takes people multiple times of hearing similar stories for it to finally connect. So do not give up. do not be disheartened when the first time you put something out there, it doesn't get a million likes. And we are happy to help share other advocacy pages, just like Fair's, with our PUT members as well, to get them to understand the importance of having that similar avenue to educate your patients. So Fair, continue doing great work in Mississippi, and we will continue helping you and championing your efforts. And we appreciate all of your advocacy work that you have done so far.
Well, thank you. And thank y'all for all you do. Y'all are just rock stars in my eyes. And I just appreciate all y'all have done for pharmacy as a whole. So thank y'all for having me today.
That's right. And gear up for legislative session 2026. So, because they have not heard the last of the SIP for PBM reform in the halls of Mississippi State Capitol. So, again, well, thank you for your time today, Fair. We greatly appreciate it. Monique, thanks for joining me as well. I love our conversations about advocacy and the fact that you allow me to do this and share my passion with our PUT members. I greatly appreciate that.
Oh, Lauren, you're the best. I appreciate you. Fair. Keep going. You're doing great. You inspire us all.
Thank you.
If you missed any of our discussion today, you are welcome to catch this and other episodes of the PUTTcast at truthrx.org. We also have a brand new PUT website that you don't want to miss. Have a great rest of your day.
PBMs are robbing you day in and day out, making you work for below-cost reimbursements. Billion-dollar corporations hurting hard-working independent pharmacy owners as they line their pockets and put so many of you out of business. And now it's happening with so many pharmacy software vendors that have sold out to billion-dollar hedge funds. Are you truly happy with your pharmacy software vendor? Is support what it used to be, or you find yourself waiting on hold? Are your issues resolved in a timely fashion? When is the last time you took a look at the bill from your pharmacy software vendor? Perhaps it's time for a change. Visit our website at www.datascanpharmacy.com and give us a call at 1-877-222-7979.